Hi, welcome to today's Leaders in Mental Wellness and Diabetes, where you will hear insights from the top minds in the world of diabetes care. Hosted by Dr. Char.
It is so good today for me to have Ahmad AlMaradni, this Southern girl, and the pronunciation. Did I do okay?
That's absolutely right. You got it.
Okay. He is a clinical endocrinology fellow. He's in internal medicine, but he has specialties that we're going to talk about in diabetes, where he did some research, and he's endocrinology right now. He's a fellow in that at Banner. He's from Syria and he lives in Phoenix. And I can't get over the fact that he's interested in obesity and diabetes technology. From an old girl that didn't even have a monitor back when 50 years ago, I'm interested in talking about that. Welcome to this podcast, sir.
Thank you so much, Dr. Char. It's my pleasure to meet with you and talk to you today. That's so nice of you to invite me to your program. I really appreciate it. So thank you so much.
From the time we met on LinkedIn, I think it was, I've been interested in talking to you about a few things. It's always interesting to me, first of all, when the younger and the newer and the freshest research and enlightenment, I always want to know that because I've been diagnosed almost 50 years ago. And it's a lot different now than then. But it's important for me to have these casual conversations. I think that we as patients go in to see our doctors, our specialists, and especially if we've been patients for a while with diabetes, and we get used to getting the information. But somehow I think it might be comforting and helpful to those if we just talk about some things within that dis-ease that somebody might be able to sit back with a cup of coffee and just learn from our conversation. Is that okay with you?
Yeah, sure, definitely.
Well, let's find out, first of all, what kind of weather are you having in Arizona today?
It's a little bit cold, so I'm surprised, for the past few days, like the temperature going down a little bit. So it's mostly cloudy. And, we are in the most sunniest city in the United States, but we don't have sun for the past few days. I think it's okay.
I think
It's
that's for
December.
us, so we don't feel so bad here in Nashville.
Ah.
No, it's today here in Nashville. It's cloudy. It looks like it wants to rain and just hasn't made a real good decision yet.
Oh, it's the same here, actually. Yeah, it's
Oh,
still like probably
okay,
brewing.
it's like we're together, right?
Yes.
So let me start off just at the depth of where I want to go. You have studied lifestyle interventions and how it helps with renal function. That sounds so clinical, and I get that it is.
Mm-hmm.
I think it's important that we understand it on a casual level. Can you just explain that a little bit to us?
Definitely, yes. So, well, we know that we have a lot of causes or diseases for kidney disease. And the most common cause, we have high blood pressure and, diabetes kidney disease.
Mm-hmm.
And, diabetes is very prevalent. So it's estimated to be around 300 million worldwide patients to be affected by diabetes by 2030, according to ADA, or even more. So the thing is, majority of these patients with diabetes, mostly type 2, they have underlying kidney problems. And these kidney problems, we have a marker that we can test and see if the kidneys are being affected by the duration of diabetes or high blood pressure, and we can monitor and control whether by lifestyle modification, which is the most important thing to consider, and medications. So doing a lifestyle modification and weight loss showed a lot of advantages for patients with diabetic kidney disease, and mainly patients who have certain like BMI above 25, you can consider them as overweight and obese patients. So obesity itself is an independent risk factor for diabetic kidney disease. So when we try to lose some weight, we try to put less pressure on the cells that filter the fluids in our body. And, we kind of like decrease the pressure and decrease the stress level, and we make them work less hard. So, and once we lose weight and we treat the risk factors for like diabetes, control blood sugar, control blood pressure, this in turn, help also further reducing the risk, not only for kidney diseases, but also have shown in several studies recently risks for cardiovascular diseases, which is very important for our patients. So, it's number one killer in the United States is like coronary artery disease. And, most people like die from heart attacks. So I think like a few years ago, even like when I was in medical school, I read that about every 20 minutes, there's a documented heart attack in the United States. So,
Wow.
Yeah.
And a high percentage of those deals with diabetes.
Yes. Because they have all of these risk factors that I consider diabetes as not a disease. I consider it as a syndrome. So in this syndrome, we have to treat every aspect of it and monitor everything. So you have to prevent your eyes from being damaged by high glucose, you have to, or high sugar, you have to prevent or try to maximize your heart health, kidney health, all of this, like also the arteries in the brain and the arteries around the heart. So all of this, if you maximize the treatments, you treat this syndrome successfully. It's something that unfortunately, I tell my patients that it's something, probably you're not choosing to live with. It's something that you unfortunately have the obligation to live with. But if you accommodate yourself to live with it and understand it, you will find your life as close to normal as possible. But if you don't, it's gonna affect you unfortunately in the other way.
Well, I love looking at it. For me, it is an obligation that I didn't choose, but I also know that I have the privilege and the responsibility to carry it out. Now, I by no means have done everything perfect. Oh my goodness. We could talk all day about what I've done wrong in that I've been diagnosed for 48 years. But I'm very grateful today that I still can see you and my feet take me where I need to go. And my heart has never had an attack. One thing that I was curious about with the kidneys, it just prompted something in me. I know about it. I know others who've dealt with it. It's not just something that I've been talked to regularly. Like I'm talked to about my feet, my eyes, my nerves, even my heart. But I'm not talked to real regularly about my kidneys. Am I an oddity in that, or is it common that we don't talk about the kidneys that much? And if we take care of the kidneys, are we taking care of the other parts as well? Or if we take care of the heart, are we securing the kidneys by the lifestyle changes? Where does that fit in? How deep does it fit in with the kidneys?
Well, so that the organs all like, inside our bodies, they work like in a very coordinated way. So, and there's a say, if you have one organ that get damaged or malfunctioned, so the other will definitely fail slowly. And that's what happened if you pay attention to, for example, to the nerves and disregard the kidneys. So if you disregard the kidneys and the kidneys start to get damaged, they will eventually affect the heart, and the heart will also start to fail. And if the heart starts failing, you will have problem with, probably like more prone to have, fluid accumulation in your body, and the kidney is not working well, and eventually all the other, the pump, which is the pump of the body, which is the heart, will get weaker, and you'll not get enough oxygen or enough blood supplies to other organs. That's predisposed to failure of all organs. So you cannot take care of one thing and leave the other. That's why it requires a holistic approach to treat everything, So starting from anywhere and not ending by like just one organ or the other. Starting with the mental health, spiritual support, starting with, decreasing the stress and anxiety level for the patient, finding the appropriate treatment for the patient, compliance that's required also from the patient side, and knowledge from the physicians, and monitoring all of the known and possibly unknown side effects of that disease, which is like we know that we have what we call small vessel changes in the body and large vessel changes, and also we have a problem with the nerves, but also we don't know probably a lot about diabetes yet. So we don't know till now. We cannot find or put a cell that's similar to pancreatic cell that's secrete insulin. So a lot of research and studies for years and years have been going on at Harvard, and a lot of wonderful job has been done there to just trying to see how what we call islet cell transplant works in the body. So they make a lot of advancement in the field, but we still have a lot to discover more and more.
Oh, and I love that we're doing that. I love that. Now, I've got to transition off, but yet at the same time, I'm curious to know, do endocrinologists typically do workups on the kidneys like they do some of the other things, or does the patient need to request that there's some kind of a blood work to see where you stand?
It's recommended for all patients with diabetes to, depending, of course, we know that we have type 1 and type 2 diabetes. It's different, like type 1 diabetes, when we start requiring insulin at early age, sometimes at old age, we call it LADA, or late adult immune system attack the pancreatic cells at late adulthood. So developing type 1 diabetes, and we have type 2 diabetes. So if you have, it's recommended that if you have type 2 diabetes and you get the diagnosis, at any time to start from the time of the diagnosis to check for these markers at the time of the diagnosis and every year.
Every year.
Yes.
That's good to know. That's really good to know. I just wanted to make sure I got something out there about that because of my lack of knowing through the years about kidney function. And from what I'm hearing you say, 25 is the BMI kind of cutoff that says our lifestyle could use a little changing. That's kind of the elephant in the room not being addressed if we didn't say that.
Right.
But at 25, anything over that may not be obesity, but enough overweightness that could impact us negatively over the long haul. That's the one thing about diabetes. I have a niece who, if she eats peanuts today, she's going to the hospital.
Oh.
But yet if I eat a donut today, it's going to be down the road a good distance. It gets closer and closer as the years go, but I am going not to the hospital after a donut because it takes so long. So there are sadly to say repercussions in it taking so long, but the blessing of that is lifestyle changes can keep us healthy and whole. It's that obligation that we don't want that builds that responsibility and privilege that we can do to keep that from impacting us. What do you tell patients that understands it's not a quick send me to the hospital? Yeah. What do you tell them?
Well, when I get my patients at the initial visits, I show my patients some data, like say, if you have a type 2 diabetes and you do lifestyle modification, including exercise, aerobic exercises, and do something to decrease stress level and lose weight. So you are 2/3 of the time more successful than adding another medication for you. So it depends on how you would like to take care of your health. I encourage all my patients to try to lose weight, do some activities like exercise, because that's the standard for everything. And not only for the diabetes standpoint, but also for patients' well-being and on the mental level as well, mental and physical level. So most of, unfortunately, so you can say some of the patients are motivated to do so and others are not. I say, like, to my patients, if you are not motivated to do these changes, you will most likely end up in an increasing amount of medications to control your diabetes. You'll probably end up requiring insulin, and you'll end up gaining more weight, and that's all might affect your quality of living and bring it down. So as rather taking steps to change your habits and take things seriously for your health. So.
Yeah, well, amenability, even when I am diagnosing in my field, amenability is so huge. Either they are willing or able. Sometimes it's hard to detect between, but if they're willing or able to take that responsibility and run with it. The inamenability sometimes, though, I think my field of mental health has been the last one in the door to be on the team. So where I'm going with this is I want to know at the end of this statement if the mental health aspect is covered in the new world with you guys in diabetes. Like, for instance, there's a team. If I were to go today, I could go see my dietitian, I could see my diabetes educator, I could see my endocrinologist, and I could see my primary care.
Right.
But typically, I don't know if I was the first one, but I think I was one of the first that worked down the hall from an endocrinologist in mental health. Because years ago, would you believe that I have had specialists in your shoes, the same credentials you carry, say to me, I would love for my patients to see you, but I don't want them to think that I believe they're crazy. See, that was years ago. And I get that that's probably shocking to you today. But the truth is, mental health was not an accepted piece in all this because of the stigma attached. Now it's almost vogue. It's so popular. I could have 3 private practices. Everybody wants it. Right. But my point is, I wish, my dream is for the day when we don't get a patient referred to us after the shock and their first initial piece of amenability. They first get diagnosed, and then they run as hard as they can to do everything in their power to do what the doctor says. And then they hit a stone wall, or they hit cravings, they hit environmental situations, they hit a million different things that we could label right there. And they fall off the wagon, and now they're not amenable, and now they refer them to us. I wish the minute of diagnosis, we were part of the team so as to help, because do you know being diagnosed with diabetes can feel like PTSD?
No.
It can be so shocking on the system, and the anxiety. I'm doing something right now, a program to reverse anxiety. And wouldn't it be great if when they're first diagnosed, they get this piece as well, or at least the opportunity for this piece, so as that we don't wait till their amenability wanes before we get them back up and moving in the right direction. Tell me your opinion on that, and how does it look out in the field for mental health, anxiety, all those things related with it?
I totally agree with you. So, the old perspective about mental health should be changed, and for good, and it's changed over the past few
It's
years.
changing.
Yes. And I totally agree with you that all the patients at the time of the diagnosis of type 2 diabetes should be offered to see mental health, not because they have something wrong.
No.
So it's not because, they think like, they have, depression or anxiety or bad thinking or anything. It's just to help them to cope with the disease. So the efforts you put for them in the beginning will probably show up later in their life, or help them also prevent all of that complications from diabetes. So I think that's very, very important point you are bringing up. So for in the area where I practice or work, so I refer patients to mental health only if they want to be started on insulin pump. So, and that's a requirement, So, and I think this should be generalized to all patients with diabetes, so they can like offered at least, so they can get the benefit. And as I said, like before, it's a holistic approach. It's like,
Yes, it is.
yeah, it's not only like you're following the kidneys and monitoring them, you're monitoring the heart, you're monitoring the lipids or cholesterol. Also, you have to look at the patient's soul and thinking, and you have also to follow this and protect it.
Well, let me tell you what is so interesting and exciting on my side. If you tell them you need a lifestyle change, now you can do that. Some endocrinologists say it real flat. Some endocrinologists say it with a hand on yours, and well, not through COVID, but some do it with gentleness, and some do it because they feel like they need to shock the patient. But the truth is, we offer them the knowledge that behavioral changes must happen. I think that's a good thing that we all can agree on, right? Behavioral changes must occur for we, the patients, to stay healthy. And what I do in mental health, see, mental health has always been looked at as mental illness a lot of the times instead of mental health. But if a patient can come to me while they're first diagnosed and they have that surge of energy to be amenable, and I can help them know that habits work until they don't, motivation comes in ebbs and waves, but I can help them go to that operating system. And so it's more than just habit changes. It's operating system, meaning your brain, of what you believe and function from that. And it's a win-win. It's just an added help. Now, this is not a mental health class today, but you understand what I'm saying. It's very important to me. And I believe anxiety comes really easy to those that are first diagnosed. And it's just an easy thing it's the biggest known mental health issue everybody deals with because of our lifestyles. And we don't have to live with it. So I think that I can just end on that part by saying, I just think that would, as we get better and better, that piece is more addressed. We're just better in helping the patient. I'll get off my soapbox right there. You like diabetes technology. And again, you understand there was no pump when I was diagnosed. There was no monitors. I didn't have a phone to tell me every 5 minutes. I peed on a stick, for God's sake. I didn't know. It was what the doctor told me when. They were limited at what they knew. And I've done super well. I'm 64 years old. I've done super well. So I know it can happen. But when they didn't even know to call me type 1, they were just learning how to do that. And then years later, I'm in this MODI study now with Chicago University, where they check my blood for 154 different kinds of diabetes that we're researching. I'm none of those. I'm type 1. I'm none of those. I'm not type 2. So I'm type 1. But I could be a lot of other things that down the road, somebody's going to benefit by what they didn't know about me. And hopefully I can be a part of that by just being a part of a study here and there. Knowing the limitedness of patients, it's not just older patients. Younger patients that's new to the disease aren't familiar with the technology. What would you like everybody to know? What could we know that would help our lives about technology?
So I would like everybody to know that we have the ability to make the life and living with the disease is easy for you. Living with the diabetes easy for you. So we have everything for you that we are fortunate now with the advancement of science and technology, so that you're just like, you're not doing any finger sticks anymore, unless like in rare situation where, you know, you have to do it to check if your blood sugar readings is good or not, but you have the sensors that stick on you for 14 days and give you continuous reading of your blood sugar. You have an insulin pump that's giving you continuously like insulin, and they are in the process of making trying to mimic binary pancreas, which is probably gonna take a few times to come down the road, like, you know. So we have the ability to help you control your disease and diabetes very well and help you to live the life that you deserve. So that's why we are here as endocrinologists. So I think all of the endocrinologists are willing to help their patients as long as the patient is willing to help himself. So, and that's once we start like educating our patients and teach them about the disease and the complications, the awareness and the compliance will be better. And that's what I would like to tell others. Try to take at least a minute or two from your busy day to explain to the patient, so what is really diabetes, you know. So most of the patients come, oh, I got my kidneys affected from diabetes, and they don't know why, you know, say, you know, just like in layman terms, like, you know. So that probably might help more compliance and might help patient asking for more advices rather than just prescribing the medications and send them out. You
know? Oh, it is so good. It's so good to know the advancements that we're having and the places that we're going to. And it would be easy for this old girl to have an attitude of like, you don't know what it's like. I was back in the day when, but you know what I didn't have the problem of that patients today have is high fructose corn syrup everywhere. When I was a little girl, when we were doing gardens, just even, I mean, I wasn't raised out in the country riding horses. I mean, I was a little further than that, but my point is, we had vegetables from the garden to eat. We didn't have high fructose corn syrup anywhere. And so as time has gone along, we didn't go to the corner gas station and get an 8-ounce drink. We certainly didn't go get a 32-ounce drink for the same price. I mean, and it was not full of high fructose corn syrup. And so, we drank water because there was water. That's what we drank.
Well, that's the good things about all days, you know. So everything is fresh. Everything is good from nutrition standpoint, you know. Now, unfortunately, most of the stuff is processed, and most of the stuff, like, you know, hydrogenated, and that's causing a lot of problems to the entire, you know, world, you know. So and it's getting more unaffordable to be able to get organic stuff, you know, and organic food. So, and it's getting, you know, for people who are busy, doctors and, you know, nurses, sometimes they are rushing. It's they find it easier to grab something and have it on the go, so.
Absolutely.
And that's only the downside about our now world.
Mhm.
But the good side is that the science is advancing, and we know what's causing all the problems. So it's up to the person to take these information and decide what to do for the next level.
Yeah, it's my whole point is, I know I didn't have the advantages that of technology that we have today, but I also know I didn't have to fight the battles that the younger patients are fighting now with the high fructose corn syrup and all. Now I have to fight it. I don't like to cook any more than anybody else. I'm as busy. Just because we get diabetes doesn't make us less busy. We just have that one more thing to make sure we do well. And so I have just through the years, I'm learning still. I've learned in the last 6 months some things to do better with insulin that can keep damage from my eyes, from 70 miles an hour to 30 miles an hour. Just certain things you do. I mean, things that we learn continually, that I think it's fortunate that we have the technologies. I think it's sad that so much of the food is damaged before we get to it. And so it makes it harder in some ways, but it still leaves us back to the point, and I'll pull this up to a close right here, but it still leaves us to the point of we have an obligation that we didn't ask for as a patient of diabetes. And yet we have the privilege, but not just the privilege, but we have the responsibility to either be good to ourselves and learn and treat ourselves well and stay healthy.
Right.
And life is not always fair. I understand we can't make it all happen the way we want to, but
we have to take advantage from.
Oh, by crackies, we can do so much for ourselves. And these bodies were made so miraculous. They heal themselves.
Exactly.
So much can be wrong, and they just, with the right care and treatment, they can heal. Isn't that amazing?
That's the perfect, that's the perfect thing and the good thing about the body, so once it start heals, like you'll feel the difference in your life, so, and that's really touching. What we are trying, just to make a simple comment, so what we're trying to say that with the advancement in science and technology in medicine, unfortunately, we're seeing a regression in, lifestyle changes. So, and that's why we are emphasizing on lifestyle changes to be the leader for treatment of every single disease, including diabetes.
Yes.
Yes.
Yes. We've talked about the mental health all the way through it. So I'm gonna spare you that question about anxiety and how it shows up. I think we've discussed it enough to know that anxiety does show up in the diagnosis and in the lifestyle changes. I so appreciate that you have a desire to help we in my community, those that might listen to me. How did you get into helping? What made you want to go this route? And obesity and diabetes, of which has been so importantly thrown at us, what made you want to help us?
Well, so when I want to help, I would like to help the vast majority of the people that I can. And when I look around, I see like the vast majority of the population suffer from diabetes, obesity, and what we call chronic metabolic changes. And to help the vast majority of these people, so want to spread awareness and education, and that also, help in reducing the incidence of all of these diseases for the future generation. And that's why I wanted to be a part of this, so helping all the patients that needs me, or that will be a gratifying thing for me. That will be like, that's my goal, actually. That's why I studied to reach to this point, to try to help people around me. So
That's awesome. Awareness and education, whether everybody takes full advantage, it's my heart to believe most people want to. And so whether they're walking in and out of your office with the limited time and limited space there to do everything, technology as it relates to this computer and how we can get on a Zoom call and how we can talk casually. My hope, my desire is that it's informative, it's educational, because after all, doesn't doctor in Latin mean teacher? Yeah. So if that's the case, healing can come best for diabetes patients, in my opinion, when we know how to self-care
or help them. Yes, I believe that I don't think that any percentage of patients with diabetes, they don't want help. All of them, they want help, but most of them, they don't know how to reach or achieve the goals or get that help.
So, they don't know how. That's why sometimes they don't do it. It's not that they don't want it. Exactly. They don't know how. And in my world, I do help people decide, is that a chicken inside your head talking, or is that a bully? I will say, now, is that a chicken saying, oh, I'm a victim, I can't help it? Or is it a bully saying, ain't nobody going to tell me what to eat? So I do believe we have some options that they may not have thought of because they just feel hopeless. And there's always hope. And that's such a good place to end. You are one of the nicest, am I respectful enough in this? Because you are one of the nicest young men
thank you
that I have met. And you being a professional, staying in your lane and studying in such a way that we know you have the expertise, but the personality and the bedside manner to do the work that's necessary. Thank you.
Well,
thank you for all of that.
Well, thank you for having me. I'm really grateful for the talk and, grateful for this meeting. You are also like nice and very hospitable. Well, thank you so much.
Thank you. And I hope this is not the last talk we have. I believe in locking arms. I believe in the awareness and the education, as do you. And I believe people want the help. And if they will kick back and get a cup of coffee and we can help them just in our little dialogues, I'm willing. If you ever need me, if
one patient's going to get help from that talk, I am very, very, very happy. I'll be very happy and gratified, so even
that's so good.
One patient. Yeah.
That's so good, because joy is their birthright and we want everybody to live with vitality, and that I think we agree. And so you take care. If you ever need me, I'm a call away. And if I find something where I need more endocrinology help, I know your number now.
You're more than welcome. You're more than welcome.
Thank you so much.
Thank you so much. And everybody probably listening to this, well, thank you so much. Okay.
And to you too, sir.
All right. Have a good one. Bye. Bye.